I've lived all over the country. I was born in Minnesota, and my family moved a lot as a kid, so I lived in Minnesota, Michigan, Pennsylvania, and Illinois growing up, but I went to high school and college and medical school in the Philadelphia suburbs. My training in surgery following medical school was at Dartmouth up in New Hampshire, and my fellowship in vascular surgery was back in Chicago. And my career, after I finished all of my training, I started as a full-fledged vascular surgeon. I think I was 39, so really kind of late. A lot of training, a lot of years of training. Started looking for opportunities to come to a place where there was a great need, where there were a lot of patients who needed vascular care, preferably one where there weren't enough vascular surgeons with my background to take care of that need. And I found my way down to Jackson at Baptist, and I've been very, very happy here. I really believe in getting to know patients as individuals, getting to know their backgrounds, their passions, their family life, their goals, because many of the decisions we make in vascular surgery about treatment revolves around risks and various benefits. So it's really important for me to know what patients value in order to help them come to a decision about what's best. We often have a lot of decisions in which there are choices, ranging from just treating with medication and not expecting a lot of change in the way a person feels due to their vascular disease, all the way at the other end of the spectrum to doing a big operation that has a lot of risks. The greatest passion of mine in vascular surgery is the need to have adapted to a whole new range of technologies that is constantly evolving, and staying in touch with other practitioners of other specialties in our care of patients with vascular disease. My mission would be to provide the best care for a patient's problem with the lowest level of invasiveness and the greatest safety that will allow for effective treatment of the problem. I'm a bluegrass musician, and have great admiration for professional musicians, and if I hadn't chosen medicine and had learned early enough in my life how to play music, I almost certainly would have done that. It's been a great pleasure to get to know the diversity of folks who are living down here, but also what kind of unifies them, which is a devotion to family and their faith. And it makes it very, very easy to provide medical care, and especially in the setting of crisis and difficulty. People have resources here in their families and in their faith, and coming together that, together with the great energy and skills of the doctors and nurses here, make practicing my specialty here really quite easy.